Hi, everybody. Welcome today to my podcast. Today, I'm really excited. Today, I have Dr. Michelle Navarro, and she is a clinical and neuropsychologist, and I was so fortunate to get her. Michelle, thank you. Thank you for being
Susan.
on this show. You know, it was funny when Travis gave me the idea of doing a podcast, and he says, you know so many people, and he says, you know, you could do a really cool podcast, you know, just educating people. And I said, yeah. And I said, you were immediately the first two people, okay, you and Dr. George.
Yep.
I am big on doctors and what they can do and anything with the brain, anything that we can learn. And I'm just, thank you for coming.
I can't say. Very excited to be here.
I love it. Now, it's interesting because for those of you that don't know what kind of a doctor Michelle is, Michelle, tell the audience what exactly is a clinical neuropsychologist.
Okay. So a clinical and neuropsychologist, there's two different parts of that.
Okay.
There's the clinical study of the brain, behavior, cognitions, kind of like how someone thinks and processes. Could be anything from anxiety to depression. And then the other part of it is the neuro part of it, which basically is going to look at attention and processing and memory. You can use it in anything from diagnostics for attention deficit to autism to brain damage, concussions, all different kinds of things, learning disabilities, giftedness. And so it's sort of the neuro part of it really runs into the testing. So, and that's the diagnostic portion of it. And then the clinical is more of the clinical intervention that comes with that, the therapy that comes afterwards.
So for people that are tuning in, you are a clinical neuropsychologist that also does the diagnostic testing.
Yes.
So when somebody has a child that's not exhibiting, normal behavior, or they're a little stuck at something, or maybe they're not learning properly.
Right.
Okay, they come see you.
Yes, absolutely.
Okay, I remember, and I share this with the audience because I'm very open about what my struggle was with Alex when she was 6 years old. And meeting you, I mean, I go back with Michelle. I mean, Alex is going to be 28 in May.
22 years? Yeah. I don't know that I want to tell people that.
And, you know, I remember getting your name from a dear friend of mine at the time, and she says, she's really good. You've really got to, you know, talk to her. And I says, okay. And I was open to everything. But, you know, I had a lot of difficulties with Alex. And this was before we knew what was going on with Alex.
Right.
And I remember coming in to seeing you. And you know what I loved about you? You're not scary. The children bond with you.
Pretty short, yeah.
Yeah, but because that's important. And you know what?
No.
Kids love you. And when you're doing these testings with these children, it's very important because, you know what? I want parents who are zooming in on this, don't be afraid to get your child tested.
I do think that's important, right?
Okay, but I remember going back and, you know, you were the one that actually really pinpointed how Alex's brain worked and how she learned. And you were the one that said auditory processing disorder, and you said she gets it all, but she's kind of like short-circuited. She's missing gaps in sequencing.
Yeah. She's going to miss the easy stuff. She's going to get the harder stuff correct. It always is part of her. I remember, you know, like anything, you know, you watch some of these kids, the simple sort of tedious tasks go by the wayside. Hand her something really complex.
Yes.
And all of a sudden she blossoms. It's actually very interesting to watch her.
Funny you said this because I remember years ago you said, you gave her some test and you said from young to 14, she bombed through the test. But interesting, 14 through adult, she soared. And I says, I didn't understand what that meant. And you said, well, the more harder, the better. The easy things she can do. And you know what? You said to me that when Alex gets older, college is going to be a breeze. And it was. She soared through college.
Because she'll be in the field where she's interested in.
Yeah.
Once she gets past gen ed classes and things like that,
right.
she will jump in and her interest level will take over. And that, I think, is the important part. Is so often, you know, people worry all the time, like, oh no, they can't even get through basic math or English.
Right.
They're going to flunk out of college. I'm like, whoa. The best part about college is usually the last half, which is supposed to be harder, is actually what they love. the most.
So it makes sense.
It makes more sense, yeah. And that's Alex Tootsie.
And she's thriving now, I'll tell you. But
Hi, Alex.
boy, people go, oh, she's so good, she's that. And I say, look, she didn't come out of a box that way. This took work. And you were such a major savior to me, because not only did you help Alex, but you certainly helped me as a parent. One of the things I wanted to share is I remember Alex was about 6.5 at the time we came back to your office, and I was just, all I did was cry as a mother. I cried because I felt I couldn't get in touch with my child. No matter what I tried to say, she wasn't listening. And I thought, what's wrong with me? And I remember coming to you, and you observed Alex and I, and she was being very difficult. And you listened, and you said, okay, Alex, you know what? You want to go out and play? Go in the office and, go in the lobby. And okay. And she went, and you said, okay, I'm going to tell you right now, I observed you too. She goes, and and I remember you saying, you literally have to take everything that you're thinking and how you're raising your daughter, and you literally have to put it somewhere else, because you're not dealing with this type of a child.
Right. And I think that's really hard for parents to hear. They're raised a certain way.
Yes.
Everyone comes in with, this is how a child should be. They read books on, this is where they should be at 1, this is where they should be at 2, at 3, at 4. And when your child's here and here and here and all over the place, you're just like, well, fix them. And I'm like, well, I'm not going to just smush your child and make them average all over the place. Take their great strengths, just make them average. Take their weaknesses and all of a sudden make them average. That's not a child, right? That's not a person. And so it's really sort of embracing the child you have.
Right.
And then reevaluating how you parent. And that even, and that goes even to multiples in a family. There's some kids you need to parent differently within even the same family.
True.
Right?
I agree.
And so you have to really, whatever your knowledge base of, if you're frustrated and you're screaming and you're saying, like, I can't get a hold of, she won't talk to me, or he won't talk to me, or things like that, it's because you have to change how you parent. You have to think about what's best for my child. Because what we try to do is think, if we just keep pushing it, they'll get it. But a lot of times they're like, you don't get it, because all they see is that you're not getting them.
Yeah.
They're getting more angry, and then they're going to go to someone who's going to get that, right?
I often said that I remember coming to your office once a week, and you were teaching me how to speak to my child. These were one-on-one sessions you had given me, and you're going to laugh, but I actually was able to understand my husband, Tom, better.
They did get along really well in the beginning.
And I says, wait a minute, this is even helping my marriage, because now I'm understanding how to talk to him even better. The apple didn't fall far from the tree.
No.
But it worked. It worked. So, okay, so here's my question. I've seen so many children and so many people's children, even when they come here, and I'm able to see so much. Well, because I know who I am. Okay, but here's the thing, and maybe if you agree, you disagree, but I'm having this thing where parents sometimes have a stigma that they don't want to admit that something is wrong, or if they take their child to somebody like you, oh, we don't want it on record.
Yep.
All right. How do you handle a parent that way?
Well, I'm always saying, okay, look, it's like anything. Like most people don't want to appear different.
Right.
They don't want to appear that something's wrong with their child. But the nice thing about kids, and I always tell parents all the time, the best thing, I love when I get them little.
Yeah.
Because if you get them little,
I know.
Right, you can help them, right?
You can help them a lot easier.
And you can help the parents. You don't have to go through like living in the darkness for the next 10 years with this child. I get a lot of parents who bring their child in at 14, 15, have been dealing with this for years, and they just thought they'd grow out of it, and they've just have this destroyed relationship with their child. And I always say to people, you know what? If something's not right, if your child had a sore throat, for a long period of time, you take them, get a strep test, you take, but something with mental health, right? Their behavior's off. Well, we just, must be, they always think that maybe there's something wrong. One, if they identify them, is there something wrong with me? Did I do something wrong in the parenting?
Right.
Did I raise them wrong? Did I do something? So there's that part of it. And then there's something of, oh gosh, like, could there, like admitting that your child may not be what people say is normal. And there is no normal.
There's no normal.
There's no normal.
Right.
There's no such thing.
That's right.
So I think I love early intervention, right? Because little ones, they're so like, you can just mold them and they really, with understanding, all they want to do is like somebody to be like, yeah, I get it, right? And if you kind of go with their play, like when you're playing with a child and you kind of go with their play, and you can get a parent to see, look at this great relationship you're building. Now, all we have to do is maybe get some interventions in, right? Some processing,
Right.
probably maybe there's visual processing that needs to go on. Maybe there's neurofeedback for attention. Maybe there's a social skills group your child needs. Maybe there's an impulse control that they need they need to work on, parenting skills that you could enhance. But really, all of that is just building relationships, right? Because at the end of the day, that's what we have, right?
You're right.
I mean, we all, like, when you walk away from everything, at the end of everything, you want relationships, right? You want, think about what people always are asking you. They want to connect again, right? With loved ones.
Very much so.
And I think it's really important that you connect with them now and then later.
God, I love what you just said. Connecting now instead of later. That's beautiful. It's so true. It's funny because when I see people that are adults that come in my office, or I will have wives or even husbands. It isn't just a female thing or a male thing. They're going to tell me something about their wife, or, my husband, he was a very, man of, few words. I see something more there. I always will say, did you ever think that your husband had autism spectrum disorder? Scientists, engineers, architects, doctors. They're the ones high on the Richter scale of having this.
Right, absolutely.
They're wonderful at their jobs. Okay, but when it comes to personal relationships, so here's another thing that I always tell people. Find out what's going on. Don't let them be an adult and then say, oh, something's wrong. Because I really believe when you go undiagnosed, you know when you're different.
Yes.
Alex said this to me a long time ago. She goes, Mom, I know I'm different. She was about 7 years old and she told me that. And I says, why do you say that, Alex? And she goes, because I know the things that I can't do like the other kids, and I know the things I want to do that they don't want to do. And she goes, so I know I'm different. And I go, well, there's nothing wrong with being different. She goes, now, you say that, but when you have to be different and you have to try to act as normal as you can, she goes, it makes my head hurt. And I'll never forget that. And that bothered me. And then I thought to myself, okay, so Alex was lucky because Tom and I, we were into all of this stuff.
Yep.
And I do believe in this.
You were open.
Yeah, I was. Because I says, okay, there's no blame here. Let's figure it out. I want to try to help understand how my child is. And I never looked for curing. I just wanted to make her life better, okay? And I needed to make my life better by understanding her. But I think about these poor people that go their whole lives undiagnosed. They go from relationship to relationship, and they constantly can't even keep a relationship, or even a job for that matter.
Well, and I think that's the interesting part. And even when they do, sometimes, they have troubled relationships or things. Many times I diagnose kids.
Yeah.
And the parent will ask, do you do adult testing? And I'll
yes.
say, yes, I do.
Yes, so you do it across the board, so I want to make that clear to the audience.
Right.
You do it with everybody.
Absolutely.
I love that.
So, again, so often, like when you get to see your child, and like you said, Alex is a little more like Tom,
Oh, God, yes.
Well,
yes.
Think about it. It usually doesn't, children don't fall far from the tree.
I agree with you.
You just got to figure out what part they're falling, you know what I mean? And then a lot of times, it's that, finding that out for yourself, working on that, right?
Right.
It's really great. One of the things that I see, like you said, the interesting thing is you said it helped with your own relationship.
It did. And I have a great marriage, and I always say this, knock on wood, I've always had a good marriage because he was always willing, first of all, to understand me, which is not a walk in the park. But not only that, he has this longevity of just letting things go. He just lets me go. But he understands that, but he also trusted me enough to make the decisions that I felt were really good for Alex, that would be the best for her. He never said, no, we're not going to do that. No, we're not. No. He was open to a lot of that stuff.
Very open.
So really, but some of the things that he kind of looks at, or sometimes the way he would see things, and it's like, what is it you're not understanding? I would sit there and tell him all these different ways. And then one time, I got so disgusted, I remember just drawing something on a piece of paper. Drawing. the actual picture of what I was trying to say to him. And he looks at me and goes, oh, you didn't say it like that. Got it. Now I know what you want to do. Oh, okay. I looked at him. I'm like, are you kidding?
And your daughter's a photographer. Yeah, okay.
Yes, right? We're duh. It's me. No, see, it's not their problem. It's me.
Exactly.
So, looking back at that, it did help my marriage because it helped me understand a different way of thought.
A different way of thought, a different way of communicating,
yes.
a different way of connecting.
Yes.
It all goes together, right?
Very much so.
But if we are ignorant of that and don't know that information, we just keep running into the wall, and again, that definition of insanity, doing the same thing over and over again.
So
and
true.
Never getting a different result. That's what parents do with, they'll be like, I just have to, have more timeouts. I just have to be stricter. I just have to be this.
No.
I'm like, wait, no, maybe not.
No.
Is that working? No. Is yelling louder working?
Oh, no. God, no.
No. How's the timeouts working?
Right.
They don't work. They get up and leave. It makes it worse.
Yeah. It made no sense to Alex of a timeout.
Right. What does that mean?
It didn't. But I would make deals with her. If you do this, then we'll do this. Mm-hmm. And it worked for her. Mm-hmm. Because to her, it was like, okay, a job well done. So if I do this, it's no different. And I had a parent one time saying, you're bribing your kid to go to Toys R Us if she gets 100% on her spelling. I said, yeah, but it worked.
And you're rewarding her.
Well, yeah, but I said to her, what does your husband do for a living? She goes, well, he's a trader. And I said, okay, so when he has a good deal, he gets a good bonus at the end of the year. What's different?
Yeah, but here's the thing. The difference between bribery and reward, if you hand a screaming child a lollipop to shut them up,
no,
right?
I didn't do that.
That's bribery. Rewarding is different, right?
Yeah.
It's like a job. You do a good job,
you
get to go there. So there's a difference when people are bribing their kids, as they say,
See, I didn't
versus
bribe her.
reward.
She had to earn it, but if she earned it,
then she got to go.
Yeah, it was a great, but I also taught her follow through, but for her, that seemed to work for her.
Yeah.
It did. It was like that give and take. She's like, okay, if I do this, then I'll get this. I said, yeah, you'll get this. And you know what? She did it. It comprehended with her.
Yeah, no, and that's exactly it. I remember, my son being uninterested in the alphabet,
Okay.
And he wanted this Doberman stuffed dog, and I'm like, well, if you get the he's like, and then he's like, oh, if I do, and he actually negotiated, if I do this.
He did.
And then he wrote out the alphabet, did everything they told him to do.
See?
He had no interest in it. Mm-hmm. There was nothing for him. Mm-hmm. He negotiated with me a payout, and he got paid.
Good for you. See, right. but look, it's a win-win.
It's a win-win, absolutely.
Yeah, see, I think parents have a wrong analogy to what needs to be done with their children when it comes to assessing them, how they learn, how they process, or even learning. I think all parents who are having difficulties connecting with their children need to maybe learn how to speak to them.
Well, and I think that's really important because so often we think if we look at me or get in my face.
Yeah.
And sometimes kids, especially with auditory processing.
Alex could never look in me in my eyes.
Right. They can't look.
No,
they actually get more confused.
I know.
Or if there's too much emotion, and this is what I said with parents all the time, when you rise up too loud, you lose the content of what you're trying to say because all they hear is emotion, right? So it's just blind emotion.
Great point.
And that's where I always tell people, imagine you see two people on the street and one person is screaming at the other person. Well, you don't know what's really going on, but you think, well, that crazy person's yelling, right? Mm-hmm. You don't know that crazy person could be right, but all you hear is some person yelling. You just hear emotion.
Right.
So that's what your child hears, just pure emotion. And so, and let's think about the teenager who says, you're always yelling, you're yelling at me. Because when they start to elevate, you actually have to come down, right? Mm-hmm. So when they're rising up, you can't match them. That's like throwing a match on gasoline. It's going to blow up.
So true.
So when I always say, the higher your child goes, the lower your voice goes. Just stay, you know what I mean? If they're starting to ramp up, you can't match them. You're just going to create, you know what I mean? Now, if we're talking, we match. That's a normal part. But not when they're not when there's, getting upset.
Right.
Because we want to bring it down, right? We want to bring it down, and we want to show them also that we're not afraid of their emotion.
No.
But if we're afraid of their emotion, we're going to start. We're going to see it. We're going to show it.
God, what a great point. I love the way you said that because that's true.
Yeah.
That's just so true.
No, and it's really hard, I think, I think for parents, we're under such scrutiny to be the best, like there's this
horrible,
the best parent, the
stigma.
Yeah, like, what's your child doing? What college are they going? What are they doing? Did you get your child in cum and meth? Did you do this? Did you like all these things? And it's just like, I love this. I had this woman in the other day, and she has a 2 and a 5-year-old, and the little boy is not quite in kindergarten. And she's like, I love that. She's an educator, and she's like, I love this age. It's where there's no evaluation if they're bad or if they're, or if they're good. There's no A, there's no B, there's no smiley face on the paper. There's just go and paint that, go do that, go explore that. And I'm like, wow, you're right.
That was my happiest times.
Yeah, because it all changes after that, right?
Yeah,
because then there's assessments.
5 years old up, it starts to all change.
Everybody starts getting assessed.
Yeah, and it's sad. I know we have to do it, but I feel bad for them because I do think kids are under pressure. And when kids maybe are behind, they have that pressure that they have to deal with the other kids.
Yeah.
It's not an easy thing. It really isn't. So I guess the reason I love talking to you, and I was so humbled that you could come on this show, was because I wanted parents to hear more of the right of why they need to get their children assessed if they're having any difficulties. And it could be a long range of things.
Absolutely.
I mean, sometimes I even say to parents, maybe your child is the A student. So your child's not, struggling, but maybe on an emotional well-being, maybe with relationships or connecting. So there could be various ways.
Well, and I think that's often you see that, call it many different things, as you call them, brain allergies or twice exceptional. You see kids that are bright in one area, but lacking in another. And I think that's hard to deal with because parents are like, will tell me, oh, they know it because they tell me. I'm like, no, they have great verbal skills, but they're not actually processing the emotion. And sometimes kids are high IQ, right? High, like in certain areas of IQ, but low in social development. And so when they can talk through it, but they can't handle the emotion. It's kind of like kids who are reading at such a high level, right? But then the content they read is too much for their little brains, right?
Yeah.
Because they can gobble up like chapters and chapters in a book, but the content at those chapters could be pretty scary for a young child. So they can read it, they can comprehend it, but they can't emotionally handle it.
Oh my God.
So going through and knowing what your child can even emotionally handle is something really important to do. Like, what are they reading? And can they handle that? Or are they going to have nightmares?
Yeah, very true.
So
very true. I wanted to ask you because, children with their emotions, this is a great subject that I encountered myself for many years, and I really believe that there's truth to this. Can children have a form of depression at a very young age?
Yes. Yeah, and we're still kind of, even debating, when actual depression comes about, because some people say, well, it's a cognitive disorder, so you have to be at an age where you can actually understand, what is sadness, what is emotion. But yet there's studies of babies that were deprived, very early on, and they have like failure to thrive, right? They don't eat. Like kids who were neglected, right?
Okay.
And they're very skinny, and they just kind of fail to like want to eat, want to do anything. They've been crying out, and no one has ever picked them up. So they see that in very overpopulated orphanages, and then kids just start to deteriorate. And so other people are saying depression can start whenever, whenever a child's needs are not being met, right? And then there's also the fact that there's also a biological base to a lot of the depression. So you can see in families where there's a lot of depression, you might see it at an early age too.
So what age have you seen it in? Maybe I should just ask you
you know what? I've seen it. I've seen kids as young and 4 and 5 as be like clinically, like where, parents are like, they're not getting out of bed, they're not doing anything. Usually at that point, sometimes there's, biological basis for it, right? Sometimes even, in sad cases, early onset of any kind of, say, schizoaffective disorder, which is a mood and a schizophrenia, sometimes that. But other times, like just say in traumatic events, you see it anytime like early conflict in the house, very traumatic death of a parent. And then, because what people don't understand is, or even not even death of a parent, I've had kids have almost post-traumatic responses to a parent being very ill. So then the other parent has to attend to that one, and then they get just like all these different variety of people just coming in and out of their house. And if they're at a young age, their attachment to either parent is very poor, right? So they have indiscriminate, ability to, attach to their primary caregiver. And then sometimes there's just, inconsistent messages, coldness because, there's been so much going on. So it's really hard. And it's not common at a very young age, But what we are definitely seeing is the rise of anxiety and depression come down. It's coming younger and younger each year. And I believe a lot of that has to do with the pressure at school at a very young age that yes, I really believe that parents are pushed to, the homework that we've shown that for homework, there's almost no correlation between homework and grade school kids doing any better.
Really?
None. No.
I didn't know that.
Oh yes, a great road. Is it Road to Nowhere or Race to Nowhere? I'm losing it right now, but that's a great documentary, and it talks about they've done lots of correlations with homework, and really very little homework shows correlation with grades. Okay, so meaning, and then test scores later on, but we continue to pile it on. Little kids will end up in 3rd grade with having to do big projects. Well, those are parent-run projects. Now the parents are stressed and the kids are stressed because they're not using time management. But 3rd graders don't have time management yet, but they're supposed to because they were given an assignment. And so it's this crazy societal thing. So I'm noticing more parents are stressed. That puts stress on the children.
Sure.
And it's just coming down. And so I talk about the kids that are coming through younger and younger. And then you look at say things like a school refusal and anxiety program that started in, usually is in high school, is now going down to the grade schools, you know what I mean?
That's rapid. That's huge.
And those are huge. Hospitals are expanding those. They're full. They're full, especially times during finals or big tests. You can't get a child in if there's school refusal and anxiety because there's no rooms in the hospital. And guess what? That's where they're expanding.
What would your advice be from children at a young age when they are experiencing anxiety? What are some of the things that you would tell a parent that they can maybe help their child?
Okay. So depending on the anxiety, first off, it's really just talking to them about what is a fear, because first of all, parents get into calling it an anxiety. They have anxiety. I'm like, first, we're not going to use it in front of kids as anxiety. We're going to call it a worry, right? We're going to call it a worry. We're going to call it a fear, right? Yeah. And fears, we're afraid of something, and then we're not, right? We like a dog, but then we're kind of afraid of dog, and then we finally pet the dog. We're like, okay, we're now not afraid. So a fear, right? A fear, a worry, is something that's passing, right? But for some reason, when you hear anxiety, and when kids will come in as young as 9 and be like, I have anxiety. I'm like, well, they're hearing it,
right?
And instead, I'm like, you're worrying a lot. Even depression, I hear with kids very young ages. I'm depressed, and I'm like, okay, let's talk about it. So if you're talking about, first off, is really getting your vocabulary to be like, okay, you're nervous, you're worried, really making it something. And those things pass, right?
Right.
Because if you talk about it as something that's a trait, you're depressed, you're an anxious person, then it just is something that's not going to go away. So really it's also learning the vocabulary. There's a lot of great things you can do with kids, but it starts with yourself too, because many people don't realize that they themselves are very anxious, right? And you have to first analyze the parent's behavior. Are you doing anything that your kid could think of as anxious? And many times when you watch the parent, they're just absolutely demonstrating it for the child.
So true. I think children are sponges. I always say that.
Absolutely.
So what could you do? And okay, so I'm the nervous parent, and you've looked at me, and what would you say for me to try to help my child calm down?
Okay. Well, one, I would say, look, just what you said. They're sponges. They're gonna, and a lot of parents will say, yes, you're right, I'm anxious. I said, okay. So if you're anxious, you have to be a better role model, right? And you have to then learn how to face your own fears, right?
True.
And so, and then, the other thing is parents don't realize, how they react. And it's just when something goes wrong, like something goes wrong, when they see you like, oh, I can't believe this happened. Your job is, it happened. Okay, it'll be all right. Like if a child's worried about like, I just struck out in baseball. You did. I know, you got another time at bat. It'll, you have to be the model of, instead of be like, now stop it, be a good sport, instead of lecturing, right? Be like, yeah, you're right, right? Because as a friend, right, do you really want to get a lecture from your friend if you're kind of like complaining about something that happened? No. But you kind of want your friend to be like, don't, you know what? There's another time up there, Susan. You're going to be all right. You know what I mean?
Okay.
Instead of just saying like, Susan, you should be grateful for the things you have, and you should be a better sport, and you should, you
know what? Nobody wants to hear that.
Nobody wants to hear that.
You're right.
And even little kids, it's like the Charlie Brown, wah, 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 wah.
And I think people forget how smart kids are.
Oh, yeah.
I think they're smarter than us.
Oh, yeah.
Because they're more pure. They look at something and they rationalize it like that.
Right.
They got it.
But the other thing too, and the other thing I would say is stop telling your kids what they can't and cannot do. Like so many people,
so true.
I know, like you can't do that. You can't.
Yeah, you can.
And, yes, you can. Yes, you can.
Yeah.
It's kind of like, I can't let them pour the milk because they spill it everywhere. I go, well, eventually they got to learn how to spill. They got to spill it like 5 times before they're ever going to get it.
I agree with you.
And they're like, they can't reach that. We don't want to do that because that's up on a high shelf. I'm like, well, put it on a lower shelf.
Right.
Again. It's like I have high schoolers that have never touched a stove, have never
really,
never, like
really,
their parents are like, well, we don't want them using fire. They call it like this. They go fire on their own, and I'm like, okay, they are teenagers. So teenagers are like coming to my office. They don't know what boiling water is. They've never made macaroni and cheese. They've never, you know what I mean?
They don't know how to do it.
So again, it's all those things is. Every time you do something for your child, you rob them of the opportunity to do it themselves.
Oh, God, great point right there.
So stop.
Frozen moment right there.
So stop robbing our children.
That. Yeah.
Stop robbing them.
Yeah.
Like, just because that's in their way. Like, think about little Alex when if something was in her way, she'd figure out a way to jump over, move around it, kick it out of the way.
She did.
Why do we keep moving it for people?
I never told her no. I mean, when she had to do something, we found a way for her to do it. I just, what my biggest fear was? Because she's an only child, and you have that too. Okay, my biggest fear was that something was going to happen to Tom and myself, and she was going to be alone, and she couldn't do anything. That was my biggest fear.
So you parented out of fear?
Yeah, I did, but I made sure that she would know these things, and I didn't want to ever give her limits to things that I thought she couldn't do.
Okay.
Okay.
So yes.
It was a fear, but I kind of turned it into something good.
You turned it into more positive.
I did, because I didn't want her to be dependent on me or her father.
Right.
There's always going to be a way that she's going to be dependent. The love,
the
emotion.
Of course.
Okay? I mean,
it is what it is. Absolutely.
I mean, we all do that. But I'm talking about her learning how to do something.
Right.
Okay? She was making her own sandwiches at 3 years old.
Right.
And, I would watch her and I go, yeah. And she goes, yeah, I could do this. I'm like, okay, go do it. Let me see how you do it. Show me how you do it. Oh, my God, that's a great sandwich, I used to say. I mean, she probably put the whole pound up.
Do you know what? It's all right. It's okay.
Right?
You know what?
But
it was a great sandwich for her. It was a great sandwich for her.
Yeah, and she ate it. But my point was, it's like, I didn't want to make her feel like just because I thought she couldn't do it, that she couldn't do it.
Right, absolutely. No, and that's the funny thing.
I
belief.
just didn't want to do that.
Your
to
belief
her.
system has to be, it can be done, right?
Yeah.
And if it can't, right? Let's say they try and they try, just be like, oh, you know what? We'll figure it out at one point.
A different way.
We'll figure it out a different. Let's look up. And here's the thing.
Yeah.
And sometimes it's just that. It's like when parents do things like cheerlead it instead of encourage. So like when you see a child and they're writing or they draw something and they don't like the way it looks and they want to crumple it all up, parents are like, no, don't do that. It's beautiful. I love it. I love it. And instead what I would say is, well, what do you think is wrong with that? What would you like to do that's different?
Oh,
what
I
is
like
it?
that. That's
What
so nice.
Instead of don't invalidate that they don't like what they just did. Talk to them like, what is it that you do different? You know what I mean? And then you can say things like, I didn't see it that way. I like the way you did this, or I like the, be more specific.
Yeah.
I like the way how you drew the curve this way on the person. Talk to them about what you liked. Don't disagree, don't invalidate. Stay with, talk to them about what they're upset about, right?
I always would say to parents, when I would see parents go, oh, high five, good job, good job. And I'd say, well, what's good about it? Are you telling them? You're just telling them it's a good job, but tell them why you liked what they did. What was it that made it a good job?
Absolutely.
Right?
Absolutely. No, that's exactly.
Yeah.
What specific? And they talk about this in terms of specific versus general, right? Like in terms of giving, when you want to give a compliment, be very specific. Do not give a general, you're smart, you're great, you're fantastic, right? I like what you did on that story. That was great. I really like your ending on that. Really love how you saw something I didn't see in that picture. Again, it's specific, right? Because now you talk to kids and they'll be like, when you talk about like girls have body image, and they'll be like, and the mom will be like, I've always told her she's beautiful. The dad's like, I've always told her they're beautiful. They're like, that's what parents are supposed to say. What I always say to parents is, one, don't talk badly about your own body if you don't want your girl or your boy, because we have more body, you know what I mean? Like, so when women, we're all going, oh, look at me, oh, like this, oh, your daughter hears that, right? And actually now your son does too, because we are seeing the rise of boys with body dysmorphic problems, okay?
Wow.
So that's another newer thing that we're seeing out there too. So again, just being aware of how you present to your child.
Wow, you made a great point. I like that. Yeah, being aware. And it's funny because I really believe that parents sometimes don't realize what they're doing.
Oh, yeah.
But here's the problem, and I don't know if I think the problem too is don't worry about being their friend. Be a parent.
Right. You're not their friend.
No.
You can later on. You're going to
have
a
it'll change. It'll go to a different stage.
It'll go to a different stage.
Yes.
But the idea is that friends is reciprocal, right? You and I can talk back and forth, right? I could dump on you, you could dump on me. But you're not supposed to dump on your child, right?
No.
You're just supposed to give, right? You're supposed to listen. You're supposed to, you didn't have them so that, they were supposed to fill, what you needed in life, right? And so again, it's that they aren't, you know what I mean? And you're there to guide them, give them some boundaries that they know. Here's the thing. Your boundaries don't have to be here.
Right.
Just your boundaries have to be here, right? And just that small, like, if they just get a little too far off the path. But be careful about how narrow the path is, right? That, I think, is the part where, and I think that with Alex, I always saw with you, the path was pretty wide. You kind of let her go. And as long as she was kind of just like doing what she needed to do, that's what makes her a happy adult.
I think you have to find what your child is showing a positive interest in, because that is going to start bringing their self-confidence up.
Yes.
And that, to me, was priceless, because I thought, kids hear enough what they can't do or what they struggle with in school, because it's called school and that's what you learn. I get that.
Yep.
But what about things that they do well? And maybe put that in that path. Give them a class of that.
Yes.
Let them take that creative class. Let them take the photography class or the jogging class or the nutrition.
Absolutely.
I mean, there's so many classes about so many things, but give them that opportunity.
Absolutely.
Okay. I had a quick question on this, and I was thinking about this, and it came to me. What would you suggest parents with IEP?
Okay. So
for those who don't know what IEPs are.
Okay, so an individual education plan, okay? And that falls under the category of special ed, okay? Which, as soon as I say that, parents are like,
I know.
Whoa, my kid. All it really does is special services. So it like guarantees hours, right? So what that means, service hours. You're going to get speech for this, or you're going to get writing help. So a lot of people, because of the name, like
it freaks them out.
Freaks them out, right? And so, but I'm just saying, imagine you are guaranteeing your child some real help from the school. And it's a document that is legal. So they have to provide that support.
That's right. It's a contract.
Exactly. It's a contract. And that's the really nice thing about it. And it's a contract that works, the school can collaborate, parents can collaborate, the child as they get older can collaborate on that. And that's what it should be, right? And so not to be afraid of that, not to be afraid of that, as people say, stigma. I do think it's getting less and less, but I still think that people are hesitant to go to that route. There's still like, as soon as they hear that it's under the special education kind of like umbrella, I get like, ooh, maybe not. Maybe not. Do we really want the school to know? Is that really? And people worry that it's going to go on their college application, that that, and it's not. Okay. It's not.
It doesn't go on. Okay.
No, you don't. There's nothing that your transcript is your grades. It doesn't have a little asterisk that says you were on an IEP.
Okay, so everybody, you just heard that. It doesn't go on to something on college or the transcripts. It goes nothing. Just your grades.
No, just your grades. Your grades go.
Interesting. So
on your transcript is your attendance and your grades, right?
Yeah.
And your classes that you took, right?
Okay.
Now, when you get into college, though, and let's say you had an IEP in school, you could then go to student services. They can call it student disability. Every college has a different name.
Right.
And you could take that and you can then bring it to college. And if you had extended time in high school, you get extended time. If you took it in a smaller class setting, you can get a smaller class setting to take your tests. Instead of taking it in a huge lecture hall, great, smaller classroom.
Yeah.
It's really nice. You need a note taker? That's fantastic. We'll get you a note taker. So these are some really neat things that if you have in high school, from early on, you know what I mean? You can take those and use them in college. And I do testing, like updates on testing for people who are taking the law exam, the GRE, the MCAS.
Really?
Yes, because that all falls under the Disabilities Act, right?
Oh my God, I didn't know that.
So,
great idea.
So the thing is that, also, testing goes beyond just your original testing. Updated testing, like, I wish this is the one thing that changed. I used to say, you know what, you just need to have testing like one time. You can come in and maybe do a re-eval, maybe later on, but you shouldn't have to do it throughout your life. The only time you actually need to have something re-evaluated is if you're going to take the GRE or the LSAT to get into law school or get into graduate school or get into med school, where they sometimes want updated testing, okay? And then if you take like the bar exam or some of the boards, sometimes they'll want the testing updated.
So, okay, that just jarred me. When children are in elementary school and junior high and even maybe high school, how often would you recommend parents get their children reassessed? Because the brain is constantly changing, right?
Now, here's the thing. The school, once the IEP is in place, is supposed to traditionally do that, like keep the assessment process going. But what I'm noticing is, that they're doing less testing, right?
Are they really?
Yeah, so they're doing less testing as time goes on. Like once it's set, right, and the IEP is working or things are going, you know what I mean? I see less testing. The only problem sometimes that plays in is the testing boards, ACT, SAT, or some schools for college don't want it any more than 5 years old, you know what I mean? So you have to be aware of, like how old the testing is. So one, you can ask your school to reassess, okay? Now things like if it's dyslexia or if it's other things or processing where they won't do that type of testing, you might have to have it redone, okay? Just prior to taking some of the bigger standardized tests. Just because it plays a part, you know what I mean? It plays a part. Now, I am like, hopefully you always try to do, you know what I mean? Like you said, we never want to put kids through hours of testing if we don't have to. But a lot of times we also want to see if there's been change, right?
Right.
Did it work? Do the interventions work, right? Do they work? Have we seen an improvement? So I think those are things that sometimes need reassessment. But not everyone needs a reassessment. It's something that you have to know down the road. Am I going to keep using this? If you are, you're probably going to need some reassessment.
Okay, I love it. I do. I think this is so much knowledge. But what I liked about this is that you actually brought all of this in to understand for parents not to be scared, that these are things that do come up. You have alternatives, but I call it modification.
Yes, modifications.
That's all you're doing.
Right, and modify the environment.
My God, I love that. I do. I cannot say thank you enough. How can people find you?
Oh, okay. I am at Long Grove Center for Emotional Health. That's in, and that is in Long Grove, Illinois. You can reach us on our website. You can.
And what's your website?
It is. Oh, it's a long one, so it is.
Okay, we're gonna say it slow.
www.longgrovecenterforoemotionalhealth.com.
Perfect.
Just spell it all out just like that.
I like it. I like it. And you know, and this is something that I want to say this. I can't say it enough. There are different ways to help your child, your spouse, your friend, your niece, your nephew, your grandchild. How you see this is not how it needs to stay. This is why I'm doing these podcasts, because this is food for thought and it is everything, and you have alternatives. Michelle, beyond thank you.
Great to see you again, Susan.
Love you. You're a wealth of information.
Thank you so much.
Alex and I owe so much to you.
Oh, she's
over
a sweetheart.
The years, and I'm serious. And Alex is proof of success.
Oh, she's a doll.
So, and this is because of her. Thank you.
Thank you.
Tune in again to the next podcast, and wishing you all the best. Take care. Bye-bye.